Good morning and good afternoon to everyone who is joining us on the 2023 Rare Disease Day. This is a webinar that's being organized by the Myotonic Dystrophy Foundation. My name is Kevin Brennan, and I have been an advocacy consultant with the Myotonic Dystrophy Foundation for almost 10 years now, and have been working with Tanya and with the board on efforts to increase awareness of myotonic dystrophy among federal and state public policy leaders, and also efforts to drive increased funding for research, which is a lot of what we're going to talk about today, and also with the goal of leading to improved understandings of myotonic dystrophy, and also ultimately FDA-approved treatments and a cure. I'd like to welcome everybody to our webinar. Okay. So we, the Myotonic Dystrophy Foundation, are joining with our partners around the globe. Organizations in the United States and across the globe are uniting together on Rare Disease Day, which is an annual event. So what is Rare Disease Day? Rare Disease Day was launched in February 28th in 2008, and it's a global movement of rare disease advocates, and it was launched to advance social opportunity, health care, and access to diagnosis and therapies for people living with a rare disease like myotonic dystrophy. It aims to change and improve the lives of the 300 million people across the globe who are living with a rare disease. It includes individuals, families, caregivers, healthcare professionals, researchers, clinicians, policymakers, industry representatives, and partners who are working collectively to raise awareness and take action that's going to lead to improved healthcare, therapeutics, and care for people who are living around the world with a rare disease. So the Myotonic Dystrophy Foundation, many of you may know, has launched a global alliance. Many of the organizations that are a part of it are in these slides, which you'll be able to access after the webinar is over. But it spans 15 countries and includes 57 partners. Those partners include nonprofits, patient advocacy organizations like MDF. It includes researchers, academic medical centers around the globe. It includes hospitals, healthcare providers, and clinics. It includes schools, and it includes our biotech and pharmaceutical colleagues and clients and partners around the world who are driving clinical trials and research that we hope are going to lead to approved therapies and cures for people with myotonic dystrophy. So, wanted to just provide a quick review of the last decade. What has the Myotonic Dystrophy Foundation, through our grassroots advocates, what we have collectively been able to. So if you look at this timeline, which starts in 2014, you can see Kayla Vitek and her mom, Lisa, and they were testifying before Congress in support of the Muscular Dystrophy Care Act. And so we partnered with multiple organizations across the United States to help get that important piece of legislation passed into law. That includes multiple Wellstone centers, which are focused on muscular dystrophy. And there is a particular Wellstone Center that is focused on myotonic dystrophy, which is an important component of that legislation. At the time in 2014, National Institutes of Health, or NIH, research funding, which is the primary vehicle for biomedical research funding outside of the private sector in the United States and across the globe. But as we get to talk about some of our research priorities going forward, so keep that in mind. So then moving into 2015, it was the first ever Myotonic Dystrophy Foundation annual meeting in Washington, D.C., and it featured a very important United States Senate briefing on myotonic dystrophy research funding. You look down below, you'll see that our NIH funding stayed flat at $9 million. The purpose of that briefing was to begin to focus in on a program that we're going to talk a lot about today that is housed at the Department of Defense up at Fort Detrick, Maryland, which is about an hour north of Washington, D.C. And it's a program that we were seeking to be included in for the first time ever. So 2016, we hosted the first ever patient-focused drug development meeting in Washington, D.C. that was done in partnership with the FDA. And it was the first time any organization had ever worked with the FDA to stress the urgency of patient-centered myotonic dystrophy treatments. So it was a very catalytic event where we brought together viewpoints from patients to influence, how and shape how the agency and how the biopharmaceutical sector starts to think about myotonic dystrophy. And it was a major catalyst for a lot of the research advances that we're now starting to see in the clinical trial phase, which we hope in the next 2 to 3 years are going to result in actual new drug applications going to the FDA, which will be reviewed by the agency. And if they establish that they are safe and effective products, they will be approved and come to market. And these would represent the first ever FDA approved treatments for myotonic dystrophy. And a lot of that work happened in 2016. Again, our NIH funding was flat at $9 million. So moving into 2017, we had heard from the community that there was difficulties, and some of those difficulties we know continue to this day, but where folks who were seeking to get benefits from Social Security as a result of their disability through myotonic dystrophy were having challenges. We identified that there's a program called the Compassionate Allowance Program, and we were able to make an advocacy case with the agency and met with them in Baltimore several times. And they then added congenital myotonic dystrophy to the list of conditions eligible for that program, which is designed to help streamline the applications process and make it much more easy and more quick. And so as that goes forward, it's helped some, but not all of the folks. But in another area where we've made, I think, an important advance in awareness, but also getting the community to help this agency in question understand why we needed to make this change. This is also the same year that as a result of the patient-focused drug development meeting, the Myotonic Dystrophy Foundation released the Voice of the Patient report. If you go to myotonic dystrophy, myotonic.org, you can find a copy of that report. And again, that was a really foundational piece of information that helped advance a lot of the research findings that we're doing today. So you see there was a slight uptick in NIH funding for myotonic dystrophy. Moving then into 2018, this is where things changed significantly. So the Myotonic Dystrophy Foundation had been working for years on making changes at the NIH, or to advocate for changes at the NIH to increase funding for research. And we were having modest to some years flat funding. And so instead of just continuing to do the same old thing, we decided we were successful in getting the United States Senate to add for the first time myotonic dystrophy as an eligible condition for research under the peer-reviewed medical research program. And that resulted in an increase of $3.1 million in new funding. Well, that's not funding that's simply just given out to researchers. You have to compete for those dollars. But the fact that myotonic dystrophy researchers were for the first time ever allowed to participate in that program and compete for dollars was a huge change. And there was an uptick in NIH funding that accompanied that, but that was probably the most important part of that year. Moving into 2019, Tim Halen from Massachusetts testified before the House Appropriations Committee, again as part of our efforts to continue to push for increased funding at NIH. The PRMRP program was funded, researchers were funded at $2.4 million, NIH was at 12. So then moving into 2020, in the annual spending bill, Congress continued to recognize the importance of DM research. They encouraged the NIH to look to the fact that we don't have a FDA-approved treatment and emphasize that. And you can also see then where we had $2.3 million in PRMRP funding and $3 million in NIH funding. Moving into 2021, Senator Tim Kaine from Virginia and Senator Lummis from Wyoming, a Republican from Wyoming, and several other senators introduced the first ever Senate resolution declaring September 15th as International Myotonic Dystrophy Awareness Day. We joined many other countries that had been recognizing this, and that was an important milestone in our efforts. We had a little dip in PRMRP funding at $300,000, and NIH funding was at $11 million. Moving into the last year on the chart here of 2022, the Senate passed the Myotonic Dystrophy Awareness Resolution, and Congress also launched an important initiative called the Repeat Expansion Disorder Initiative, which is something that the Myotonic Dystrophy Foundation pioneered recognizing that myotonic dystrophy is a repeat expansion disorder with about 50 other related genetic disorders, including ALS, Huntington's disease. And so researchers, Eric Wang at the University of Florida, and many other folks who are part of our community, were working with NIH, and we're continuing to work with NIH to see if there's a way that we can get this initiative launched that will increase funding further beyond the base level of funding at the NIH. And then most exciting of all, at the end of last year, PRMRP announced a groundbreaking, record-breaking level of funding, $8.8 million in 1 year in funding for myotonic dystrophy research. Just opportunity. Last week, we worked with the PRMRP program to hold the first ever webinar with some of the research community to let them know about how they can continue to participate in this program to make it a little bit easier, we hope, for them to apply for funding, so that maybe this number will continue to grow over time. But this was just absolutely amazing. And our NIH funding, again, hovering around $12 million. And moving forward, let's talk about what is it that we're doing here on our research advocacy priorities. So our goal for this year's Rare Disease Day is to continue to urge the United States Senate to support myotonic dystrophy and maintaining our eligibility in the Department of Defense peer-reviewed medical research program. So it's important to know, and I'm going to make this point several times, every year diseases and conditions have to be approved by the Senate to be added. You start the year at 0. And so if not a single voice is heard in the Senate to advocate for our inclusion, it's very easily that we would just slip out and not be considered an eligible condition. It's important that we go through this exercise every year. We've been in the program for 6 years in a row, and I'm rounding this up. You might see in some of these slides, it'll say 16.9, but total, if you round it up, is 17 million in research on top of all of the NIH numbers that I mentioned. And so a few of the folks that we want to recognize in the Senate who have been champions, who have recognized myotonic dystrophy and has worked with us to help be included in this program, and it's a very awesome bipartisan list of senators. I mentioned it's Senator Tim Kaine from Virginia, Senator Lummis from Wyoming, Senator Amy Klobuchar from Minnesota, Senator Durbin from Illinois, Senator Susan Collins from Maine, and Senator Dianne Feinstein from California. And I left Senator Feinstein last because she was the first person in the United States Senate to lend her voice in support of our efforts to be included in this program many, many years ago. And she's been a great champion. But we've worked across the country to continue to build support beyond just Senator Feinstein, and we're going to continue to do that with your help. So what is the Congressionally Directed Medical Research Program? Why does it exist? It's a little unusual to think that there's a program in the Department of Defense that would be focused on myotonic dystrophy. So this was established by Congress in the year 1992, and it was largely led by advocates in the breast cancer community because they were frustrated that NIH was not spending a lot of research funding on breast cancer. As this program has evolved and it has grown, there's been more of a focus, if you will, what they say, on the war fighter. And so one of the things that we did when I mentioned that earlier Senate briefing that we did at the first ever annual conference, we focused on the fact that there were a lot of family members that we were hearing from who were discharged from the military, not knowing that they had myotonic dystrophy. They might have had symptoms. They might have been excessive daytime sleepiness that interfered with their work in the military. The myotonia may have had a hard time as they're trying to get a gas mask on or actually handle a weapon. But it wasn't until after that they were discharged, in some cases, dishonorably discharged, did they get a diagnosis of myotonic dystrophy. So we were able to make a case with the Senate folks that we worked with that there was a strong connection between individuals in the military and myotonic dystrophy. And so that was one of the areas of success as far as awareness and letting them know what we were trying to accomplish. The Congressionally Directed Medical Research Program is kind of the overarching term that's used for about 35 research programs that exist that the Department of Defense funds. We are located within one of those 35, and that's where we get the PRMRP acronym. So just so you guys know that. So again, just to stress, how does this process work? So each spring at least one U.S. senator. In our case, we managed to secure support for more than one, but one U.S. senator must intentionally add diseases and disorders to the funding eligibility list. And really what that means is they, in the letters that they send to the chairperson and the top person of the other parties, so the top Republican and top Democrat of the appropriations committees, every senator will send a letter annually for the Department of Defense budget, and they'll list things that they want to see included in that budget. And so we need to have at least one senator include in their letter that myotonic dystrophy be included. If they don't, then we won't be included in that program. They don't automatically just add you because you've been there for 6 years. You have to continue to do that. So that's why today's advocacy that we're talking about is just so absolutely important. Without Senate advocacy, myotonic dystrophy would not be eligible for research funding. So this is just laying out for folks, okay, where have we been and where are we going? And I've largely covered in this chart. But again, I'd like to highlight the fact that we've seen real growth in the last fiscal year, which has gotten us close to that $17 million mark. And again, these slides will be available after the talk. Underneath of here, you'll see that there's a source for folks if you want to dig a little deeper and understand exactly what this means. But that's where we've gotten it from as far as the program goes. So then going back to, the NIH funding, and I want to point something out here, and Tanya and I have been working with the NIH on this. You'll notice in 2020, everything tracks along here, and then you see a bump where there's $24 million. So there's a study that's a cancer study that NIH has told us also includes some component of myotonic dystrophy. It's a very small component. We had asked them actually to remove that study so that it didn't affect the timeline or the funding line in the way it does. And we're going to be talking to the intramural researcher up at Bethesda at the NIH who's doing this program to find out a little bit more why they believe that this should be included in our line item. And also take advantage of that opportunity to see if they're doing something in myotonic dystrophy, maybe there's more that could be done or more that we can learn from that. But that's why if you see this timeline, you've got that bump there that just seems a little out of sorts. So I'm going to talk a little bit about the congressional budget process just to give you a top level sense of where we are and where we're going as far as where Congress is in this process. So this process starts at the beginning of each year, and it starts with the President's State of the Union address, which was a few weeks ago. So after the State of the Union address, the President then releases their budget proposal to Congress and to the public. It's usually a little sooner than early March, but that's when we're anticipating seeing the President's budget. One important thing to understand is the PRMRP, CDMRP programs are never included in the President's budget. And it's a bipartisan custom because this is something that is uniquely driven by Congress. So when Congress then begins the process of putting the budget together, either ignoring parts of the President's budget or embracing those parts, it has to be driven by Congress deciding to keep that program moving. So then as we move into the spring, the House and Senate will start to do hearings on the various components of the budget. And so they'll invite, say, the head of the NIH to testify as to what's happening there and answer questions from members of the House and Senate. Same would happen with the Department of Defense. As that process comes to a close, usually in May, June, that's when they start to actually then put together the congressional appropriations bills or budgets that will include, PRMRP and all the list of diseases and conditions that would be included through the process of what they call a markup. And I think the theory of that is when Congress, early days would have the budgets, they'd bring them through committee and they'd be marked up, literally take a pen and write new numbers in there if they were going to change them. But a markup is simply when they vote on that particular piece of legislation and move it then to the House floor. And that process all generally happens over the summer. Then as we head into sort of the September timeline, if the House and Senate have done their work, then they have to come together on a conference and decide, okay, you have, $10 million for this proposal. We have 8. Do we come to 9? It's generally that simple. And then as it's supposed to happen is by September 30th, they're supposed to have passed the budget because the new fiscal cycle then starts on October 1st. Lately, unfortunately, that has not been the case. And we've had to operate under what are called continuing resolutions, which simply keep the government funded at the previous year's fiscal levels until they can work out an agreement on a final budget. And that's usually a process that drags into December, unfortunately, and has led to these very large, what they call omnibus appropriations bills that just have everything thrown together into one bill. Now that we've had a change in leadership in the House of Representatives, the Republicans are saying they're going to operate without doing these large omnibus bills, and they're going to proceed with smaller, individual packages. But we'll see how that all lands. So, all that being said, what we're here to talk about today is we want you to continue or to become a new Myotonic Dystrophy Foundation advocate. So as we think about today's Rare Disease Day call to action, what are we asking you to do? Well, first off, we're asking folks to consider contacting your United States senators, because it's the only body that has any influence over PRMRP. But maybe you say, not ready to do that. I'm not ready to call, write, or email my senators or their staff. Well, maybe you'd want to consider participating in a myotonic dystrophy research study or clinical trial. We'll talk a little bit more at the end about that. Maybe you want to sign up to the Myotonic Dystrophy Family Registry if you haven't done that already. Or maybe you just have to, this is a good reminder to be a self-advocate. When you're in your community, when you're among your friends, make them aware on an individual basis of what your daily living, what it's like for your friends and family of living with myotonic dystrophy. Be a self-advocate when you're in your physician's office. You're making sure that you come organized and you're thinking about the things that you need to do to stand up and be your own self-advocate for your care and for your health. So if we start with the Senate offices, how do you start that relationship? Where do you begin? So the place to begin, and we've done a couple of screenshots as we walk you through this, is to go to congress.gov. And if you go there, you'll see ways to contact your senators and also your representatives. But for now, we're going to focus on the Senate. So I've pulled up Senator Chris Van Hollen from Maryland. It's just a random example because that's where my parents live, in Maryland. And you can see his website. And I know this is a little bit small, but at the very top, there's his web address. And when you're in your computer, if you click on that, you will be taken to his website. And so at the very top, you'll see Chris Van Hollen, about constituent services, issues, contact, investing in Maryland. So you've got those. Generally, every website's a little bit different, but they try to be as user-friendly as possible. So you're going to generally see some sort of a bar that's going to have a way. So if you go to the contact button at the top middle section of the screen, it will take you to the next part of the website. And it used to be that you could have, say, one email address and you can email emails, directly to the senator's office. I think in the days now where you can have spam and, all these things, they've all set up parts of the website where you have to go and sort of provide, information through the website rather than just sending a direct email. So this is what that looks like, again, on Senator Van Hollen's website. I think if you go to your other senators, it's generally going to be the same. Might look a little different as far as the color or screenshot pictures and things of that nature. But in general, they're going to want you to fill out, the name, first name, last, your contact information, street address, hometown, kind of as you walk down there. And it's really important that, they only have so many resources. So they're going to respond to people from their state because that's who's voting for them, who's elected them. That's who they're there to represent. So if you were from California and you decided to email Senator Van Hollen, chances are that's going to get pushed over to your California senators because they simply don't have the staff to answer everybody from around the country. So then if you decide you wanted to communicate to them and ask for a meeting request, and I'm going to get to in a second sort of talking points and the letter that you can use if you go back and you want to communicate via an email. But this is basically the same. You have an option of scheduling a meeting in Washington, D.C. if you were here. You could schedule a meeting in one of his state offices. You could also, have a meeting that they may set up with you for the staff if he's unavailable, if the senator's unavailable. But again, they just want to know, are you from, what's your name? Are you from their state? Are you a constituent? And that's what's important. So you'd either get that meeting with the senator or more likely with the staff, just given how busy the senators are. So then if you have the opportunity to send an email and you want to put a letter in there that helps describe what we're trying to accomplish, our call to action here, right? So again, name and your hometown, really important. And then provide, a little bit of personal information. What is it like? Again, the awareness component of this. What is it like to live with myotonic dystrophy? How does it affect your job, your life, your family, your medical care? I mean, all of the things that, that are difficult about this. It's really important to set them up so that they understand that. And remember, they're meeting with lots of people in a given week. They're hearing from lots of constituents on different issues. And so this is your opportunity to leave a very sticky message in their minds about what it's like, okay? And then let them know very simply, Senator, I'm asking you to please include myotonic dystrophy as an eligible condition in the fiscal year 2024 Department of Defense peer-reviewed medical research program. And then always say thank you very much, be respectful, and say I look forward to your reply. Generally, they're going to be smart enough to make sure that they get back to you, but you want to hold them accountable for that and say, look, I'd like to know where you stand on my request. So then getting back to this, so here's our call to action, right? So we're talking about we want to email, call, meet with your senators and their staff if you'd like to. And so we've included links here to myotonicdystrophy.org. This is where you can go and get all of the information that we've talked about on the advocacy priority. So the copy of the letter that you could use, and you could simply cut and paste that and include it when you go to the website to communicate via the email part of the website. But then make sure you personalize that before you hit send and provide a few extra sentences in there about your situation, how you feel, what you're managing on a day-to-day level, your hopes and dreams, what are all the things that you want to let them know about. It's important to do that through that component. If you want to participate in a research study and clinical trials, and this isn't a or, this is an and, it may be that you decide you want to go down this first and you're not quite ready for the Senate piece, that's fine. But we'd also encourage everybody on this call to think about participating in a clinical study or trial. That's going to really be important as we go forward. That's the information that's vital. That's what's going to be part of that application that the FDA is going to look at. And so without that data, it's more difficult to prove safety and efficacy and to get us towards our goal of FDA-approved treatments. And then finally, if you haven't already, think about joining the Myotonic Dystrophy Foundation's, family registry. And again, there's a link here that you can go to join that. So several of the folks joining us today I know are from abroad. They're our international partners, and we're really thrilled and delighted that they're a part of this journey with us and part of our global network. And so we wanted to just say a few words to folks who are from other countries. And I think we've had folks that I know of who have contacted us from Canada, Australia, and the United Kingdom. And so these are countries that have similar but not identical forms of government. We have a Congress with a House and a Senate. We have a presidency that's elected every 4 years. When you're in the other countries that have parliamentary democracies, elections can be more frequent. And usually, I think not usually, almost always, the individual that occupies the role of president or prime minister is a reflection of the majority in a parliament. And so the chances of divided government are much less likely in some of our sister democracies overseas than they are in the United States, where we have to navigate with a Democratic president, a Democratic Senate, and then a Republican House of Representatives. That there's kind of a difference there to that, which can be have some advantages over our form of government in the United States, but maybe also some other challenges or obstacles. So I think in any important successful advocacy campaign, think about the problem to be solved. So right now in the United States, one area that we're trying to solve is we see that there is there's been a funding for myotonic dystrophy has been lower than we'd like it to be. So we've been working hard over these many years to try to correct that problem and try to increase funding. So maybe it is that in your home country, research is a problem. That's an area that you want to be focused on. Maybe another interesting difference. The healthcare system in the United States is very different than a lot of the other countries around the world, in that we don't have a national healthcare system. We rely in many ways on employer-provided coverage. But it might be that if you're in the United Kingdom, that there's something within the government-funded system that needs to be addressed, that's being unfair or is not is overlooking necessary care for people with myotonic dystrophy. Maybe that's the problem that you want to solve. Maybe there's a challenge around disability benefits, similar to what we talked about with Social Security. So I think the important thing is to obviously start with what is the problem to be solved, and then figure out, okay, who are your representatives in Parliament? Who are the representatives that you elect to represent your interests, your needs, and then figuring out how do you communicate, how do you meet them, how do you talk to them. So I think in every case, all of these elected representatives have websites. There's usually a site that represents the Parliament, and you can go in and try to figure that out. And I think it's important. These are folks that work for us, that are there elected by the people to represent their constituents. And so, I encourage people to not be shy, figure out who they are, and don't be afraid. Don't walk into those situations, whether you're, in the United States or overseas, worrying that somehow you have to suddenly become, a legislative expert. That's not your job. Your job is to be an expert on living with myotonic dystrophy and understanding what your needs are and presenting that to them and asking for their help, and then having them help you figure out what exactly is the path forward. So, come up with a very simple, in the United States, we would use what we call a one-pager to try to very quickly summarize the problem and what we think some of the solutions are, and then present those ideas to our legislators. Because folks are busy, you can provide other peer-reviewed research or scientific clinical evidence to support your effort, but I think it's always important to keep at least the cover page to your request very simple and easy to understand and quick to read, and then have those supporting materials underneath that. And then as you put all those together, call, email, or request, a meeting, virtually or in person with your representative, and talk to them about what you're trying to accomplish. And then begin to work with them in partnership to come up with a plan to try to advance it through the legislative process. It might be something that doesn't require legislation. Maybe it requires you talking to whatever the national or federal agency is that manages the program that you're looking to influence. Maybe that's where you go at the suggestion of your legislator. But ultimately, what's important is that they hear from not just you, but your neighbors, our physician colleagues, partners, and any other interested individual that wants to support us, because there is strength in having as loud and respectful a voice, through this process as possible. So those are just a few ideas to share with some of our international friends who are joining us today. And again, at the end, my email address is going to be up for folks who are either in the United States or overseas who would like more questions or comments. So as you, if you're on today's call, or for folks who maybe want to recommend that other folks watch this webinar later, if your spouse or friends or colleagues are at work or just not able to join today, if you go to the Myotonic Dystrophy Foundation's Digital Academy, and you'll be able to find a copy of today's recording. All right, so that concludes today's webinar on Rare Disease Day, and I'm really grateful and appreciative of all the folks that have joined, and we can open it up for questions. All right. So our first question, is there other funding for myotonic dystrophy in the federal government? So yes, I think when we think about research, we've covered the two research areas. One is the National Institutes of Health, which, as I mentioned, is one of the largest biomedical, it is the largest funder of biomedical research in the world. And then there's also the CDMRP program with PRMRP underneath that's there. So federally speaking, those are the two, major research funding areas. Obviously, there are folks who age into the Medicare program who have myotonic dystrophy. So there's a major federal healthcare component in that. There are also folks who qualify for Medicaid healthcare coverage, and that's important. And as we mentioned, the Social Security Administration, under the disability component of that program, also provides coverage for folks with myotonic dystrophy. And so those are kind of the major areas of focus. As far as health insurance is concerned, folks might be aware of the Affordable Care Act, otherwise known as Obamacare. And I think what's important to know about that program is prior to the establishment of that program, private health insurance companies could deny health insurance coverage for anyone who had a pre-existing medical condition. So if you were, say, seeking to buy individual coverage on the open market, or even through an employer, they could actually restrict or deny individuals coverage because you had a pre-existing condition like myotonic dystrophy. So it was a major landmark change to say that's not going to be allowed anymore in this country. And so, in doing that, what they attempted to do was to increase then the pool of healthy people who might have been younger, so that health insurance premiums didn't skyrocket because there were only folks involved in the coverage who had a pre-existing condition. So we have all the individual state marketplaces now that are open, and for folks who may qualify with lower income, there are subsidies that are available. But I think that was an important advance in the United States in making sure that folks had greater access to health insurance coverage. I think there's much more work that needs to be done. Our system is far from perfect here in the United States, but that's another area where you're seeing federal resources being applied. And I think lastly, the Centers for Disease Control and Prevention, they do a lot of work in the public health space in helping to influence clinical treatment guidelines, but then also they do a fair amount of work in trying to gather information about prevalence. So they've been a major and important partner with the Myotonic Dystrophy Foundation as we have continued to develop as strong and robust a data set as possible around the prevalence of this rare disease. All right, we got another question. Okay, so what is READY? How can we get it funded? What would we need to say to the NIH for them to fund it? So that's a great question. So thinking back to the international slide where we talked about, okay, what is the problem to be solved? What opportunity are we looking at here? So for us, part of the problem to be solved was the NIH funding has been flat for a decade for myotonic dystrophy. And the current peer review process where researchers submit proposals to the NIH, and those proposals are graded by their research peers, and ones that make the cut are funded, and ones below the cut don't get funded. So we looked at that process and said, something's clearly not working here. There's something that's not right. And some of the researchers who are part of the foundation's scientific advisory committee said, look, we're actually learning a lot more given some of these more robust diagnostic tools, that there are repeat disorders, genetic disorders like myotonic dystrophy that are related. There's about 50 of them. And I mentioned one of them is a rare form of ALS, or one of them is a form of ALS. But you've got Huntington's disease, you've got several other conditions, right? It seems as if there is a huge opportunity here for the NIH to focus resources on these family of disorders. And I think we've seen sort of across the board, there's been a lack of funding in this area. So what we approached Congress about was to say, all of these researchers are having these findings, but we're not seeing a lot of interest or activity on the part of the NIH. And so Congress, through the appropriations process, included language in the appropriations bill from last year that said, hey, we encourage you to really think differently about this area. So we think, given the fact that myotonic dystrophy has kind of been the leading edge of our understanding about what a repeat disorder is, that this will lead to a significant increase in funding for myotonic dystrophy. So Tanya Stevenson, our CEO, has reached out to the head of the NIH, Dr. Tabak, and has requested a meeting. And we're continuing to work with the agency to see if we can get together with them to have a scientific conversation about what this new READY initiative would look like and how it could help fund and invest in some of these questions that we think are incredibly interesting and important, not just for people with myotonic dystrophy, but for people who have related disorders. So more to come on where this is landing. But right now that we've successfully convinced Congress to take this on, which they support, Now we're working the next step of the process, which is to talk to the scientific leadership of the NIH about that. And then one important note too, as we were talking about the president's budget submission, when that budget comes out, one of the things Congress has asked NIH to do is to provide them with a preliminary report on where they stand in implementation of the READY initiative. So in about 2 weeks or so, we will have a little bit of a better sense of where the NIH is on beginning to implement and fund this really interesting new initiative and research. Okay, so we've got a whole bunch more questions here, so apologies now, I'm seeing these. So we've got a question here saying, could you speak about more about the specific ask for NIH funding? And there's one that's related to that, so let me get to this first one. So we haven't given up on the NIH funding. I don't want to convey that we're ignoring that and we're focused solely on the PRMRP program. I think I answered some of that maybe with the READY initiative, but what we're trying to do now is we were able to get Congress to look at this differently. In general, it's been our experience collectively across a lot of different patient advocacy organization experiences that Congress is reluctant to fund disease-specific research at the NIH. So in general, if you go to them and say, we're not getting enough funding for myotonic dystrophy research, help us fix that, they generally come back to you and say, well, we are reluctant to get involved. Back in the day, they used to literally call it the disease wars. They'd feel that you were pitting diabetes against heart disease versus myotonic dystrophy. And they would always say, you know what, we're not researchers, we're not scientists, we trust the NIH peer review process, we're not going to get involved. Now, that's not to say there aren't exceptions to that rule. And I think if you look at Alzheimer's disease, which has had a massive increase over the last several years, that has been an area where they've been more than comfortable in doing disease-specific research. But recognizing that that was unique, I think that's why the READY initiative has been important. You have more success advocating for a larger scientific idea, which may lift your particular objective and others. So that's why the READY initiative, we think, is not just going to advance the best science, but it's also going to help advance our NIH research funding. So I hope that answered that question. And then I think the related question to that was from the advocate who asked, so what was behind that bump? So that $24 million bump that we saw in I don't have the slide in front of me, but the fiscal year that we looked at on the slide. We mentioned that was a cancer study that we had reached out to the NIH recently and said, hey, this doesn't look right. This intramural project, meaning it's something that wasn't funded at, say, the University of Rochester. It was intramural, meaning there's a researcher at the NIH campus in Bethesda who secured that funding and was looking at that. So we plan to talk to that researcher soon to understand a little bit more of whatever connection they're citing for myotonic dystrophy that justifies them including that extra $10 million in our line item. But didn't quite smell right to us, and we wanted to make sure that there wasn't a problem there. So we'll let you know and keep you posted on that change to that line item. So the next question is, thinking of ways to increase awareness of myotonic dystrophy in the community, would it be helpful to rent a table at a community health fair to do this? And would your office help figure this out? I think that's a great question. I'd be happy to, I can't say that I have the specifics around what the foundation can do relative to that specific request, but I think that's something that I'd be happy to answer and even hand off to one of my colleagues who may have a better sense of community health fairs and how that works. But I think it's, any opportunity to promote awareness and partnerships is vitally important and one that we support. But as far as the specifics on how to support that individual effort, I don't have an exact answer there, but I love the thinking on that. So the next question I've got here is, sorry, I'm just going to open this all the way. Please describe one more time the way to find your slideshow on the Myotonic website. It's going to be under the advocacy section of the website. And so I'd have to go back in my slides, and I don't think I can do that right now. But there's a link in that particular slide that shows you where you'd go to get all the information you needed on advocacy. And then for other folks who are interested in the clinical trials or the family registry, all of that information would be found on that slide. And so I think hopefully that answers that question for you. Right. Well, I'd like to thank everybody for joining us this afternoon. And I really appreciate and hope that everybody has great success in promoting awareness and action on this 2023 Rare Disease Day.